The patient is a 31-year-old female that weighs 180 pounds with a BMI of 29. She has a family history of type 2 diabetes. She is currently asymptomatic. The review of symptoms reveals polyuria, polydipsia, polyphagia, and nocturia for the past 1 or 2 months. She experienced weight gain for the past several years, but lost about 5 pounds in the last month. Current medication regimen includes Advil over-the-counter PRN for pain. Hi, how are you?
Good.
My name is Victoria. I'm going to be your nurse today.
Okay. How are you? This is my mom, by the way.
Hi, nice to meet you. I'm good. Okay, so before we can figure out what's going on with you today, I'm going to do a quick assessment. So can you tell me your name and date of birth?
Angelica Hernandez, 9/27/97.
Okay, so do you have any allergies?
No.
Do you have, are you taking any medications right now?
I take Advil when I'm in pain sometimes.
Okay. Do you have any past medical history? No, past.
Yeah, they're really healthy.
Okay, past surgeries?
No surgery.
No surgeries.
Okay. Do you have any family medical history?
I just know that diabetes runs in my dad's side. I think like everyone has it.
Okay. And diabetes doesn't run in on your side?
No, we are healthy. We have other issues, but not that.
Okay. Alright, so I'm going to take your vital signs. So I'm just going to take your blood measure. Sorry.
Is it normal?
Yes, there's normal blood pressure. Okay, no retinal changes. Your eyes look good. Let me take your temperature. Okay, so your temperature is normal. I'm gonna listen to your lung sounds. Ready? Take a deep breath in. Yeah. Okay. Okay, so your lung and your heart sounds are normal. Okay, so you said you haven't been feeling like yourself. Tell me more.
I've been like peeing a lot during the day, and then like a lot at night too. It's been like waking me up.
Okay.
You've been really thirsty too.
Yeah, I've also been really thirsty and like really hungry.
Okay, how long have you felt like this?
Probably for the last like few weeks.
Okay. Have you been experiencing any weight changes?
Over the past few years I've been gaining weight, but in the last month I lost like 5 pounds.
Okay. Alright.
Without doing any diet, pretty much we have
Yeah.
to do.
Okay,
And just living
how
the
is
same.
your diet?
Not that well.
Okay.
I'm very picky, so it's really not that good. I don't
Okay.
like vegetables.
Okay. So I see that you went and got fasting labs.
Yeah, I went the other morning and got my labs done.
Okay, so I'm just going to take a look at that. Let's see. Okay, so your fasting blood glucose was 245.
Is that high?
Yeah, that's pretty high. And your A1C is 8.8.
Is that high?
which is, yeah, that's pretty high too.
What is an A1C?
An A1C measures the amount of hemoglobin in the blood that has sugar attached to it over a span of 3 months. If there's too much glucose attached to the hemoglobin cells, you'll have a high A1C. So if the amount of glucose is normal, your A1C will be normal as well. In your case, the A1C is high, which means that I should probably make a call to the doctor and see what he will prescribe to control your blood sugar.
Okay.
Okay.
Dr. Baker, make it quick.
Oh, sorry. Hi, how are you?
Hi.
So I'm calling about a patient that came in before. She's a 31-year-old patient. She's not feeling well, and she stated that she has not felt herself lately. She has a history of diabetes on her father's side, but has no past medical history. She stated she's been experiencing polyuria, polydyspnea, and polydysphagia, and nocturia for the past 3 weeks, and has also stated that she lost 5 pounds in the last month. She says she has like a bland diet and doesn't like vegetables, so she doesn't really eat that well, but she has no known allergies and takes Advil over-the-counter PRN for pain. The patient is ANO times 3 and is able to make her needs known. Her vital signs are within normal limits. There's no complaints of pain. Her lung sounds are clear to auscultation, applicable pulse, normal rate and rhythm. There's no retinal changes noted. But she had a fasting blood test done, and her results show a fasting blood glucose of 245 and an A1C of 8.8%. What do you recommend?
Okay, for that patient, I'm going to prescribe PO 500 milligrams glucophage, and yeah, I just want you to continue to monitor her and tell me if there's any changes.
Okay, so I just want to repeat the order back to you. So PO 500 milligrams of glucophage.
Yeah.
Okay. All right, so I will let you know if anything changes. Thank you.
Bye.
Bye.
I hope the doctor actually has an idea of what's going on with you.
Hi.
Hey, how are you?
I'm good. Okay, so I just got off the phone with the healthcare provider, and he said that he wants to prescribe her 500 milligrams of glucophage. So that's also known as Metformin, twice a day with a meal. Okay. So if you guys have any questions regarding the medication, and
What does Metformin actually do?
so it's supposed to be a management for type 2 diabetes. It may be used with a diet, insulin, or any other oral hypoglycemic medications.
Okay, can that be used with other medications?
Yeah, sometimes it's used in combination with insulin or as per doctor's orders, of course, but you should always report if any changes of over-the-counter medications or anything or prescribed medications that you're taking.
Is it safe?
Yes, it has been available for oral treatment of type 2 diabetes since 1995 and is recommended as the first-line drug for diabetes. Okay.
Is this medication affordable?
Well, it depends on your pharmacy, but the generic form of the regular release and extended release Metformin are very affordable.
Okay. How does actually Metformin, what does it do to the body?
So Metformin works to make your body cells more sensitive to insulin, and it decreases the amount of sugar that's produced in your liver.
All right, well, should we be aware of any signs and symptoms, adverse reactions?
It may come with a fishy smell, but that's completely normal, so it's okay.
Okay, are there any life-threatening things that we should know?
So Metformin can cause lactic acidosis. It can occur when there's a buildup of lactic acid in the blood due to low oxygen levels. But it's very important that you know that this is a very rare side effect.
Okay, and what are the signs of lactic acidosis?
So even though they're very rare, the signs include feeling very weak, unusual pain, trouble breathing, stomach discomfort, nausea, vomiting, feeling cold, dizzy, suddenly slow or irregular heartbeat. If you notice any of these signs, you should stop taking Metformin and call the doctor right away. you can prevent this also by drinking lots of water and maintaining a balanced diet of fruits and vegetables. So
You should start eating some veggies.
Maybe. Is there anything else that I should worry
there's
about?
there's other side effects, but these aren't as life threatening. But you should definitely call us up and let us know if you do experience them. There is going to be nausea, possibly due to the fishy odor, but like I said, the fishy odor is completely normal. There might be abdominal bloating, diarrhea, but just let us know if you develop these symptoms during the treatment. Metformin can also reduce the absorption of vitamin B12, so it may make you feel groggy or tired, so maybe you could try taking B12 vitamin supplements. So,
Where can I find those?
they're
Are they prescribed?
no, you can find them at any like pharmacy.
Over the counter?
Over the counter, yeah.
How can I prevent being like nauseous, abdominal pain, diarrhea? I don't like that stuff.
So all of that can be avoided if you take metformin with a meal. If you
Okay.
eat well, yeah.
Okay.
Will that prescription will be always the same, or will eventually change over time?
She's gonna start her off on a low dose, and so in 3 months from now she's gonna come back. We're gonna take another lab test of her glucose. If it doesn't get better, then the doctor is I'm gonna notify the
Probably
healthcare
increase
provider and
the-
probably increase the dose. Yeah.
Okay. Okay.
Okay. Sounds good.
You have any questions? Any other questions? Concerns?
Not that I know
Okay. Well, so I'm gonna send this to your pharmacy now. What pharmacy do you use?
of. Adelphi University Pharmacy.
Okay. So like I said, if you happen to experience any shortness of breath, muscle weakness, or pain, definitely call the healthcare provider immediately, so we could figure out what's happening. So you know it's going to be 500 milligrams twice a day. You should take it with food, definitely breakfast and dinner, if you can, by mouth.
Okay, sounds good.
All right, guys.
Thank
Hope
you.
feel better. You're welcome.
Thank you. Have a good day.
You too.